Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello and welcome to another episode of Physicians Keepers. I'm so excited to have you here today, wherever you're watching from. If you're listening on the podcast or you're watching on YouTube, this is going to be another amazing episode. I have with me Dr. Sassy Weinstein, and we're going to have an interesting conversation about her story, her journey in medicine. And so Dr. Sassy, just giving her a brief intro, she is a triple board certified physician in family medicine, lifestyle medicine, and sports medicine. She's fellowship trained in sports medicine, and she combines advanced sports medicine techniques with a holistic approach rooted in lifestyle medicine. With an emphasis on movement and food as medicine, she helps patients heal from injury, prevent future issues, and optimize their health using individualized exercise prescriptions, nutrition, and sustainable lifestyle changes. Her ultimate objective is to empower her patients to prioritize these aspects of wellness to achieve optimal health one step at a time. During her fellowship at the University of Colorado, Dr. Weinstein served as a team physician for the NCAA Division I and professional athletes, and now brings that same level of care to her community. When she's not in the office, she loves staying active, volunteering locally, teaching a group fitness class, and spending time with her husband and her two kids. So thank you, Dr. Sassy, for coming in here today. I'm so excited to get into this conversation with you. Thank you for saying yes to sharing your story.
Of course. Yeah. Thank you so much for having me on. Really excited to be here, chat with your audience. And, you're doing some amazing things and helping people and physicians all around. So just excited to be part of that movement with you.
Well, thank you so much. So you've been busy with your medical career. You are triple board certified. We went from family medicine, lifestyle medicine, and sports medicine. So, after your family medicine, why sports medicine? Why was that important to you to do a fellowship in that?
Yeah, so kind of as with most other sports medicine physicians that out there, or orthopods, my path started as a competitive athlete, kind of my whole life, starting from a very young age, but also an athlete that was sidelined by illnesses and many injuries along the way. And so I kind of knew firsthand what it was like to have something taken away from you that you were so passionate about, and something that you love doing so much, especially when movement was such a big part of my identity, then and now. And so, I saw tons of sports doctors and everybody kind of back in the day. And I just wanted to kind of, from that point, I knew I wanted to be somehow involved with athletes and sports and helping people kind of who are going through the same thing that I went through, and hopefully preventing that from happening in the first place. And so I thought, what better way than to go into sports medicine? And pretty early on in medical school, I was exposed to the field of primary care sports medicine, which I honestly never knew existed before medical school. And I was like, this is awesome. And just found some incredible mentors, got really involved in that community in medical school, and then, residency onward. And that's kind of where my path started with sports medicine. And it's been amazing.
That's awesome to hear. So basically you combine the best of both worlds, because I'm primary care, so I like to think we're the best. So now you tell me, you mentioned an early athletic career. What can you give some insight? Like, was it running? Like what was the future for you when you were little as an athlete? Like, what did you think you were going to go into?
I would say that I wanted to be a professional soccer player. So soccer was my main sport, but I played basketball very competitively also. And then kind of leading up into high school is when a lot of my injuries and illnesses started,
Yeah.
and ones that kind of kept me sidelined for a long time. So from a pretty like traumatic brain injury from
Oh,
basketball
wow.
to to having mono and Lyme disease and all of these things kind of back to back in high school. And I was like, what is happening? Right. And I mean, I especially look back on it now and like, dealing with athletes and active individuals. And I think, it just was a lot going on at that point in my life. But I still knew that sports was, my passion and being active was my passion. So I did go on to play club basketball in college, but I would say at this point, after a few more, pretty serious
Yeah.
injuries, I am, I'm retired, I would say, from, soccer and basketball, I would say, but still, working out every day and just wanting to be active in every other way.
That's awesome. I mean, you were injured. I mean, this was a dream that you had to go into the athletic field, but it didn't happen the way you thought it was going to happen. And then you were able to channel that passion and that desire into helping others now, because you've been at the other end of it, right? So now you would bring that experience into your practice. So that combined together will definitely make you a very awesome physician. So
Yes.
yeah. So
Hopefully that's what my patients think.
I mean, like I said, because you've been there, right? You know what it is to have the injury, to be sidelined, so you're not just approaching it just from the physical standpoint of treating them, but the mental struggles that they must have gone through to see, and I mean, we see it all the time where you have, a career athlete, who has this dream of what their future in sports looks like, and then something happens. And then now they have to create a brand new identity for themselves, and so having that experience, I think, makes you really great for your patients. Because like I said, you don't just deal with the body, but there's the mind aspect of it that you are actually able to relate to.
Yeah, and I think the mental aspect and the emotional aspect that goes along with that is probably bigger than, any other part, right? And from, collegiate athletes and professional athletes, obviously, that is their identity and, that is that's their job, right? For the professional athletes, but especially like these are your friends, these are your people, this is what you do, right? And so from a younger athlete standpoint, that part's taken away from you. But also now what I'm seeing in my practice is more of your everyday athlete, right? You are just active individual, but usually like a busy working professional who just has a passion for kind of movement and staying active. And it's the same thing, right? When something hurts, it's that pain that is causing this mental distress because they can't work out, right? They can't go to the class they wanted to. They can't, play with their kids like they wanted to. And so it's just in a different period of life and but still understanding that, right? Because I think, when I get injured these days, which luckily is not much, but right, when something hurts or like I'm told you have to rest for, 3 days, I'm like, that is terrible news, right?
It is.
And so being able to like really help people kind of through that. And also it's so rare that I tell people that they can't move entirely, right? Because I think that's such a key part of it is that there's usually always something you can do and some sort of modification that you can help stay active and like keep that sanity. Because when it's totally taken away from you, you are just, you're almost like just crushed in a way. And so working with patients individually to figure out a way that they can keep some sort of movement in their life, I think is kind of one of my biggest goals.
That's awesome. That's awesome. Now, what are some of the most common misconceptions that people have about sports medicine?
Yeah, I mean, I think the biggest one is that you have to be an athlete, right? And so I kind of get this all the time, and it's like, yes, while in my training, I was exposed to high level Division I and professional athletes. That is not what I see on a day-to-day basis. And I think that most sports medicine physicians who go into a private practice, that's similar to what they're doing with as well. And again, I see just active everyday individuals, right? I see parents, I see, aging adults, I see, weekend warriors, really everything. And so just wanting to stay active and be active qualifies you, and right, and being in pain, right, and wanting to
Yeah.
live your healthiest, most optimal life possible. And I think that's kind of where I come in, and what I love doing most. Obviously really fun treating the high level athletes, because it's just totally a different level. But I would say that my day to day is incredibly fulfilling and satisfying, just having your everyday person kind of get back out there and just live their highest quality life.
That's awesome. Now, you did also add to that lifestyle medicine. So pretty much like I think that's the whole package. I am certified in lifestyle medicine too. So
Yeah.
I do know it just with combining all three. I think, like I said, it's just a perfect setup to deliver like total quality care, kind of to your patient. So that's a big thumbs up on your end.
Yeah, it's awesome. I remember, so I got my lifestyle medicine board certification when I was in my first job as an attending. And I just, you feel, as most physicians do, you kind of feel limited by the system. And, and I am so passionate about the exercise, the nutrition, the sleep, the stress, how all of these are so interconnected and affect our musculoskeletal health as well.
Yeah.
And you just don't have time to talk about it in a 10-minute visit. And when I was learning more about lifestyle medicine, I think another thing that even, most physicians don't really understand kind of what that field and, what that is.
Yeah.
But I think when you combine both of them, and I pretty much every single patient that I see, whether they're coming in for their knee, their shoulder, their hip, I ask them, how and, what are you doing for exercise? What does your nutrition look like, right? How are you sleeping? Are you super stressed, right? Because so many people don't understand that if you are eating a really, highly processed diet, it's just putting your body into this high inflammatory state that is obviously going to affect your muscles, your tendons, your joints as well. And same thing if you're not sleeping, right? Then you can't recover from your workouts, and everything is just so connected. And I think connecting those dots for people and making them aware that your body as a whole, and like, I can't just focus on your knee, right? Sure, like I can absolutely make those symptoms feel better, but it's going to come back if we don't address the rest of it.
Yeah, yeah, and I said that's the beauty of lifestyle medicine is, like I said, being able to connect all those dots and being able to inform the patient that, yeah, there's a science behind this. We're not just saying something. There's actually a science behind it. Chances are, if you are putting junk in, that's what's going to come out. It's like the input determines the output. If you want to control what the output looks like, what goes in has to be right. So that is awesome. Now, throughout your course, I know from before you started, right now you're currently in your own practice, but before that, you had mentioned that you worked in a large orthopedic group and also a smaller group. What did those experiences teach you about how medicine is practiced?
Yeah. I think I've kind of been in just three very different types of practices and roles. And, I think if you told me 5 years ago, or like in residency or med school, that I was going to start my own practice, I would have been like, I absolutely am not going to do that. I have no interest in doing that. So it's interesting just kind of how the path leads you there. But yeah, straight out of fellowship, I started off my career at a really large, high volume orthopedic practice in the area, really heavily dominant in orthopedic surgeons. So I was one of the few, especially in my region, of the non-operative sports docs. And so I was a little nervous going in just because, I was like, oh my gosh, these surgeons are going to give me no respect. I'm just going to be like, this person who's coming in. And I was actually totally wrong. They were, it was such an incredibly, respectful, the vast majority of the time, environment, and a really great way to start my career off. Just kind of having these surgeons kind of all around me. I could curbside consult them, and they were just really willing to help me out in my practice, especially just getting started. You have so much imposter syndrome, right? And so it's like asking them about an x-ray, asking them about this, you know. And so it was really helpful kind of to get started in that way. I ultimately knew, even when I started at that group, that it was not how I was going to end my career, just because it's a high volume practice. You know, I was just, you know, orthopedic in nature. So visits were anywhere from 10 to 15 minutes, sometimes lucky if I got 20 minutes. But again, really good way to start my career off and just kind of get used to seeing high volume of patients, see a lot of people, but be in kind of a supportive environment. So I was there for 3 years until another opportunity came up that I was offered to kind of start the medical side of a multidisciplinary practice. And that practice had, you know, had PT, OT, chiropractic care, acupuncture. So a really awesome model. And especially, you know, that was my goal, is to like have this all encompassing kind of one-stop shop place. And so I'm like, great, you know, what better way to kind of take this next move? And like, this could be my dream job and everything that I want it to be. And so I made the decision to kind of leave the big practice and go in that direction, which again took, you know, a lot of learning, because I was, again, building a medical practice from the ground up, but kind of with the support of, you know, other people to help me at least finance it, right? It was just me figuring out all of the logistics from a medical standpoint, because there was no other physicians there. But ultimately, the environment for me was really just not suitable. I did not feel well respected. Really liked kind of, you know, everyone I worked with, but I just did not have the autonomy that I expected, and that can be super draining. I think, as we all know, and I think also not being well respected is probably one of like the hardest things to work with.
It is.
And so I ultimately just got to a point where I was like, this is not sustainable for my life, for my kids. My kids were like really young at the time. And so I felt like I had zero flexibility to be with them, or to like leave if they were sick, or get them from school or whatnot. And that was just added stress on top of it. So I ultimately decided, I was like, I need to leave. I don't really have a plan moving forward, but I do need to leave. And I was like, and I'll figure it out, because I can't be here any longer. And so that's kind of when I decided, either I can, you know, go back to the large orthopedic group, which they were like, we're always happy to have you back, you know, and it was a safe choice, right? I knew exactly what I'd be getting into. Or I could take the not so safe route and start my own practice, but do exactly kind of what I want to do and treat patients with the time and care they deserve, have the autonomy that I needed, the flexibility of scheduling as I needed. And obviously here I am. I chose the latter and started my own practice, and it's been a game changer in life, I would say.
That's awesome. It's so beautiful to hear your journey with that. You got to that point and you chose the harder route, right? Which is not typical, because most people will like go back to their familiar, their comfort zone, right? You know where the money's coming from. You don't make the hard decisions. Now this is totally different. Like, you are the one making the hard decisions, right? You're the one who's building from scratch, right? So it takes a lot of guts to do that. And so I do applaud that. Now, for those who are not familiar with direct primary care, can you explain what that means?
Sure. Yeah. So I would call myself more direct specialty care, just because I actually don't really offer primary care services at this point, kind of aside from the lifestyle medicine piece, which really is primary care. But yes, the direct care model is one that essentially is a direct communication between patient and provider, and you remove that third party, which is insurance, who tells you essentially what you can and cannot do. And so for me, what that means is that I can have an hour-long initial consultation with patients, right? And we get to have that direct communication, just me with the patient. there's shared decision making, right, about what they're doing. I get to really be an advocate for them, listen to their story, and, help to progress them in that way rather than, come in for a 20-minute visit. I can hear like one or two of the things going on, but not really getting the full story and just kind of scratching the surface. This allows me to dive deeper. This allows me to ask all the questions that I wanted to always ask, incorporating the sports, incorporating the lifestyle, getting to know the patient, where they're coming from, what they love doing. And, that listening piece is just, it is most of the story, and I think is such an incredible part of the healing. But what's so nice is that I'm not, having to submit a claim to insurance and like spending hours of my time, right? I'm a solo physician. I've got, nobody else here. And so I cannot spend hours of my time fighting with insurance companies because that would then take away from my clinical time.
Wow, it sounds like that's for you just based on your passion, right? This seems like the direct care model seems like the exact fit for you and your patients. And you highlighted some of it right already, but just kind of speak to why this model is better than the traditional model. I mean, you did say some of it when you were talking, but for people who are wondering like, direct care, insurance based, like, why would you say this works for you?
Yeah, I mean, because I think patients get better. And I think that when I, as the physician, have time to listen and the patient has time to tell their story, right, that all of that gains patient trust, right? There's more transparency in the entire process, right? They are never going to get a surprise bill from me. They will never get a surprise bill from insurance because there is no communication there, right? They know what they're going to be paying up front, and that's pretty much it. And then they can submit it to insurance on their behalf, and I'll give them everything they need. But it does so much for the patient physician relationship. And I would say the top feedback that I really get from patients is that they felt heard, they felt supported, they felt cared for, and they felt like they had a part of the decision making, right? They're not just going into their doctor and their doctor being like, we need to increase your blood pressure medication, and you're going to start exercising, and then I'll see you back in 6 weeks, right? It's like, great, how are we going to do these things, and how is this going to work with your life, and how can we make sure that you are continuing to progress, and that I am here for you if you have any questions, and can be kind of that accountability partner in the process of it all. And so I think between gaining patients' trust and the transparency and the longer visits, it just allows for better care. And I mean, as a doc, right, I think I'm way more likely to be fulfilled and so rewarded with kind of what I'm doing compared to the traditional system where you were just like going through your day, right? And it just can get monotonous. And like at the end of a long day, I just remember, especially when I was in the high volume practice, I'm like, what happened today? And like, who did I see? And like, not even recognizing patients like at their follow-up, right? I genuinely feel like I know my patients. And it's really awesome. And I think it's a really cool part of medicine.
That sounds really great. I mean, we didn't know that it's, we do have patients who come in with those complaints of, well, I needed more time with the doctor.
Yes. Yep.
And, I felt like I was rushed, or you're having them saying, well, there are a lot of problems. We cannot discuss all of it in a 15-minute slot because that's kind of what, I was allocated, because once you eat into that, you're going to go into the next patient's slot, and they are going to be mad that they were kept waiting, And so definitely, I can definitely see how a direct care model bypasses all that. Yeah. And you're able to deliver the care that you want or you think is best for the patient. Now, so you had to switch your brain from employed to employer, so to say, or entrepreneur.
Yeah.
There was a mindset shift that had to happen. Did you have some form of formal training, business wise, or were you just always, business savvy, or what skills did you have to
Yeah.
upgrade to jump into
Yeah.
this?
I mean, I think that's been the most challenging part, right? Is, I feel like even today, the clinical aspect and seeing patients by far the easiest part of the day. It is because that's what we were trained for. That's what we
Yeah.
did 8 to 10 years of training for. Whereas the business stuff I had no training on it whatsoever. And so I started listening to more and more podcasts and talking to people as much as I could who were doing the same thing, reading books. I was just trying to get information, as much information as I could about it. But I would say I am still learning every single day and figuring things out. And I think, having a growth mindset is really important, but also, figuring out the strategy there is still a lot of stuff I have to learn, and we're figuring it out, right? And I think that's important kind of for other docs who are thinking about doing the same thing, is you don't have to have it all together before starting, right? And I don't think any of us do. And I think we are all still constantly learning. I mean, look, I left my last job and I really had no idea what the next step was. And I was like, we'll figure it out, right? And so, yeah, I mean, that's by far the hardest part. We had no business training in medical school. And so it is still very much a process, but I try to soak in as much information as I can in whatever way that I can, whether podcasts, books, talking to people as much as I can.
That sounds really great. I mean, so like you said, you didn't have any formal training, and you didn't go into this. I'm guessing there was definitely some fear going into it, but you were like, okay, it's going to come and we'll fix it. Right. Which is something I said as physicians, that just kind of based on the environment we train and we are told to, there's a sort of mindset that comes in where let's do what we know has always worked. Right. If this is the outcome that we know is expected, then why do we want to do something different? So it takes, being an entrepreneur is a whole different mindset shift, because you're like, well, this may work, it may not work, but we're still going to try anyway.
Yeah. Yeah. And I think also as physicians, we're like, great, what certification can I get for this, right? To feel more confident in doing so. And it's like, we keep looking to add on, all these certifications. I just had a meeting this morning with a guy who's actually helping me with the business. And I was like, well, I would love to get a certification in this, or certifications. He's like, you don't need more certifications. Like, it is just right. It's like you get in this mindset that like, I will be competent when I have that certification, right? And it is just, it's just continuing to learn. But I think having that mindset and talking to people.
That's great. Now, what were some of the biggest fears, though, when you decided to do this? Like, what were the things that I would say maybe kept you awake at night, like thinking, what were your biggest fears that you had to overcome?
Yeah, I mean, I think was just, figuring out how I'm going to make it work, right? Or just like, honestly, in the beginning, it's like, where do I start? Right. And it is so incredibly overwhelming. And, between having to like talk to lawyers and accountants and, and setting up the practice and choosing the model that you want to do, it's like, I felt like there was a million decisions to make. And I also felt like I was totally alone in doing that, because right now you're not in this big group where you can, ask the administrative assistant, like, great, can you do all of this stuff for me and, log this CME for me? And also like, make sure, can you get my medical board certification renewed so that it doesn't lapse? And it's just like, you have so much stuff to keep track of. And I was like, how, like, obviously you need some sort of system to keep track of. But I think the way that I got through that, I just sort of made a list and I was like, let's just go one step at a time. And also, let's work on the essentials first, right? Like, I knew what I needed from kind of a lawyer standpoint and an accountant standpoint. What did I actually need to do to set up this business and have it be an official business and for tax purposes and all of that? And then started going down that list. And just kind of making those decisions, right? And with each decision, I would kind of do the research on it. I would talk to people who were doing the same thing, figure out why they made that decision. But I would say, even still making decisions today, you feel, I think, as someone who starts their own practice, alone in a lot of the time. And I think that's the hardest part, is like, you need to just kind of have a network and bounce ideas off people so that you feel like you're sort of in it with other people, even though it truly does just all come back to you.
Now, where your network is at? Because I know you mentioned that there are a couple of people who are likely doing the same thing that you're doing, that you run ideas by. Like, where did you find these folks? If someone was thinking like, okay, that sounds great, but I feel alone, like, where do I go?
Yeah.
Who do I ask? Where did you find your folks, your people?
Yeah. So I mean, I joined a ton of Facebook groups, pretty much like any Facebook group that had to do with like physician entrepreneurs, direct care specialists, lifestyle medicine, all of these people. And then I also had some colleagues that I knew were doing similar things. And so those, I would say, and locally. So those I would say kind of were my closest contacts, and just people that I had networked with in the past, like even from medical school, that I knew were kind of doing the same thing. And so I leaned on them a lot, and then just use the Facebook groups, and just kind of get involved. And you have to be super proactive and just reach out and kind of just like cold call people, whether that is just shooting someone an email or showing up at their office and knocking on the door. But you have to be okay just like reaching out to people. And if they don't answer, all right, move on to the next one. But there's so many incredible people out there, I find, especially in the, direct primary care world, that everyone is just trying to help each other and, help each other have a successful practice, but also because we are now all doing something that we love doing, and just helping each other through it, because we've all been there. So helping each other through the process, I think, is so critical.
That's so amazing to hear. It's one of those things that, we try to encourage folks whenever they're listening to these conversations that I had. It's like, whatever it is that you want to do or you're thinking about doing, someone has likely done it. Someone is doing it. It doesn't help you to just stay isolated in one corner and just be like, well, I'll try to figure out myself. I'll learn. Well, you can learn quicker when you're surrounded by people that have done it. You can learn their mistakes. You can learn their success. Like, you can, create a path for yourself that is guided by other people's stories, right? Yeah. So I'm glad that you found your tribe. And you all are kind of moving in that direction to create a space in medicine that works for you and also works for your patients. Because it sounds like just this direct care model has pretty much transformed the way you practice medicine, and the way you also show up for your patients. Now, you're very passionate about movement and helping active adults. What does that, why, I know we shared in the beginning kind of your passion with it, but just kind of give us some background as to how you show up for your patients in that way, and how you encourage them, from a lifestyle standpoint, how important it is for them.
Yeah. I would say I pretty much kind of like live and breathe movement and working out. And I think it is such a big part of my life, and has always been kind of what helps keep me grounded kind of wherever I am, whether that's, working out of my home gym or, hiking vacations or whatnot. And so I always just try to have patients be more active and figure out kind of what works for them, talking about the benefits. But I also do a lot of things in the community to help with that. And so I lead a local walk with a doc, which is an international organization. So I started my own chapter actually when I was at my first job, and have just continued it. And so once a month, I'm out there with the community trying to get people just to come walk and talk for an hour, and just, in an informal setting, but getting people out there. And then I also teach a group fitness class at a local gym. and which has also like given me the most incredible network of, you know, friends and colleagues and patients as well. But also, like, what better way to kind of walk your talk than actually teaching a fitness class? And it's really like a functional strength class, and it's awesome. And so that's once a week, and it is just, it's really awesome to be able to see people kind of in the gym, but also then, you know, then they trust you even more, right? They see you out there, and then, you know, they come see you as a patient, right? And it goes both ways. And just kind of being out in the community and doing talks. I do a lot of talks at local gyms and fitness studios, just kind of talking about the importance of, you know, movement, lifestyle medicine. So I try to get out there as much as I can and really walk that talk. And I also, like, on my social media, I try to share a 5-minute workout video. It's not necessarily weekly anymore. It used to be every Monday. But as things have gotten a little bit busier, it's been a little bit less frequent, but also just figure, you know, everyone can take 5 minutes to move, and I keep them, you know, equipment free. You can do them anywhere you want. And so I kind of try to put some stuff out there on social media too about just easy ways for people to get started.
That's awesome. Like I said, I'm glad about your journey because, like I said, you're not just talking the talk, you're walking the walk. Because, I mean, I do understand, you know, a lot of physicians, you know, we're busy, a lot of things going on, but it's one of those things where if you tell patients to exercise, you know, you want to put some credibility into that. It's like, okay, chances are you need to be working out too. If you are there saying movement is important, and they need to see you doing it.
Yes.
So they know that you're not just talking it, but you're living it, you know. So the fact that you are doing all this, and like I said, not just you're involving yourself in their care outside of the clinic is pretty phenomenal. Now, if someone wants to find you, where can they look you up? Like if someone wants to say, hey, I want to, you know, join Instagram, I want to just get some quick 5-minute tips, like where can they find you?
Yeah, so Instagram, I'm at Dr. Sassy Weinstein, and my website is coresportsmedicine.com, and then Facebook is just Core Sports Medicine and Lifestyle Medicine. So Facebook and Instagram is kind of where I share all the fun stuff. We do a lot of, you know, myth busting, sports medicine, lifestyle medicine. We do a lot of, you know, FAQ Fridays. A lot of movement reels, so lots of good stuff on there and good ways to get started. And yeah, any of those ways, reach out to me, and, you know, happy to chat with any of you.
Awesome. And I will put the link in the show notes. So thank you. And one of the things you mentioned that I think I would like to also just kind of highlight, because I hear a lot of patients that come and be like, well, I don't like to go to the gym, you know, it's raining, you know, I like to be outside, you know, well, it's winter, and so I'll hibernate and resume in the spring. I'm like, hey, this is the era we live in. Everyone has a smart TV. Like literally, you can turn on your TV, get a 5-minute walk. Like you can just walk in one spot. Like you can be in your jammies, and I tell people, like, you don't have to wear a bra. If you know, wearing a sports bra,
whatever you want.
Like just get it done. So like I said, I'm glad that you know, through your workouts and through your education, that you're able to share that information where movement can happen anyway. You know, just get moving. So it's been awesome having this conversation with you today. Now, what would you say to physicians, before I let you go, that are constrained by the traditional systems, but are curious as to building something of their own? Just kind of like what you've done. What would you tell someone if someone comes to you and says, hey, Dr. Weinstein, I'm frustrated with, you know, the way practice is going right now. I don't know what to do. I'm just looking for something that feels more crafted to me and my patients. Like, what would you tell them?
One, I would say you can do this, right? You got this. And I would say if you are at this crossroads, right, in your life, and you are really kind of thinking about what is the next step, I would say, one, that's amazing, because I feel like a lot of people don't even get there, right? And they just kind of go on with their day to day. And so if you have already kind of taken a step back and you're evaluating your life and medicine and everything, and it's not where you want it to be, make the change. right? Life is too short to just go on and be, not happy with what you're doing, right? We want to love working. We also want a life outside of work, right? And having those two, we can combine them, and, in certain situations is easier than the other, but start brainstorming ways about how you can make that happen for you and how you will bring back the excitement for medicine in your life, right? Remembering why you went into medicine in the first place and trying to figure out how you can make that happen. And there is a way. There is a lot of us who have had that same, discussion with ourselves and with our significant others and with our family. And again, the fact that, people are thinking about it, I think is really great. And I think that's why we are seeing such a big movement towards this direct care model, towards going out of network, towards, physicians leaving clinical medicine in general, is because there are so many people who are thinking those same thoughts. And so just knowing that you can make the change, you can make it happen, and you will make it happen. Just go into it with that growth mindset, knowing you can do it, get your network and go for it.
That's such amazing advice. And I do hope someone who's listening to you today who had all those thoughts in their head that they would take a step just based on our conversation today. So thank you, Dr. Sassy. You've been an amazing physician's keeper today. I'm so excited to see kind of your journey and I would definitely follow you on all those links that you talked about. But if you are listening and you want to have a conversation, you have a story you want to share, this is Physicians Keepers, and that's what we do here. We share stories. We encourage each other through our stories. Just send me an email. I'll put all the links in the show notes below, teacherdrremelo@gmail.com, and we'll be glad to have your conversation. We'll be glad to hear your story, and hopefully you get to grow through these conversations. So once again, Dr. Weinstein, appreciate your time today, and I will definitely make sure that I get my 5 minutes in, and that's a promise I'm keeping to myself today. But thank you.
Awesome.
Appreciate it.
Yeah, thanks so much for having me on. This has been a great conversation.
Thank you. Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.